As a medical doctor, I understand how a novel coronavirus can affect our region. This is a serious challenge, and we are working together to make sure that the coronavirus is limited as possible. We've prepared for this, and we continue to educate the public about prevention, and we are now responding to recent test results with all of the resources of county government. After reading last night's news, I understand many folks in the region are angry. I understand those feelings. Believe me, when I heard that family members were out in the community, I wasn't happy either. But we can't let anger determine our next course of action. I won't do that. No one will do that. And we will respond to this crisis responsibly and professionally. The family has told us that since they learned of the diagnosis on Saturday night, they have self-quarantined. We've been in contact today with the Ladue Police Department, folks in the neighborhood where the patient and her family lived, and others in the community. The feedback we're getting now is consistent with the assurances that this family has given us. Our health directors have worked with the State Department of Health and Senior Services to determine that a formal quarantine order is not needed at this time. We are still obtaining additional information, and if something changes, we'll certainly update the public. Several weeks ago, I told the public what the county's role is in this crisis, and that is to prepare, to respond, and to educate. And that's what we've done. Right now, we're in the process of responding. We have strategically mobilized our resources. We have partially activated the Emergency Operations Center, which is where you are here today. We are actively collaborating with the CDC, the State Health Department, and our regional partners. Today alone, I have spoken to the elected leaders of Jefferson County, St. Charles County, Franklin County, and the City of St. Louis. My staff and I today have also spoken with leaders of some of our region's largest employers, CEOs of healthcare institutions, and other regional leaders. We are also delivering available resources to those who need them, and we will continue working with our community healthcare institutions to make sure medical services are available to everyone in St. Louis County who needs help with the coronavirus. We also take this opportunity to remind everyone prevention is the key to treatment. That means wash your hands with soap and water, use an alcohol-containing solution to clean your hands if soap and water aren't available, avoid touching your face or your mouth or your nose with unwashed hands. If you're sick, stay home. And if you get sick, avoid contact with others. My staff was first alerted that there might be test results for this patient at 1:25 on Saturday. County staff then began coordinating with the Governor's Office, the Department of Health and Senior Services, and the CDC. At 4:01 p.m., county staff received the lab results from the state, and those lab results confirmed that the test was a presumptive positive. The DHSS officials then notified county staff that the State Department of Health and Senior Services was working with the CDC to answer questions about the process of notification to the patient. At 5:47 p.m., a Department of Health and Senior Services official notified county staff that the state had approved the patient notification script. The patient was notified less than an hour later, about 6:30 p.m. I'd be glad to answer any questions.
My coworker spoke with an attorney for the family involved, and they said that they were never told by the county to self-quarantine, that they take issue with what has been said here, and that they made that choice to quarantine their daughter, and that they were never directed to quarantine any other family member until that positive diagnosis on Saturday.
The same county public health officials are communicating with this family, another family, and have used the same process for the coronavirus that they use when they communicate with tuberculosis patients or other patients who have a disease that is potentially transmittable. I appreciate their perspective. Our county health workers are doing what they do every day, and I accept their explanation. I believe it to be true. But I think at this point it's time to move forward. I think we need to recognize that this was a lesson for everyone, that a quarantine is serious, that we need to take it seriously, that if you have symptoms and you've traveled out of the country, then you are potentially contagious, and anyone around you who's been around you should quarantine, and anyone who is around someone in close contact that has received a positive test result should self-quarantine as well.
Do you believe it was made clear to this family that all members of the family should quarantine? Made clear by the county?
I believe our professionals in the county health department who do this every day did the same thing they do every day with everyone else. This is the first time that we've heard that someone didn't understand it clearly, but I believe at this point it's time to move forward. I don't believe that dwelling on this accomplishes anything else other than the opportunity to learn that a quarantine is serious and that we need to respect it, and we need to understand that this is the first case we're dealing with in the community. We expect more, and we will be asking everyone who is exposed to self-quarantine as well, and that includes exposure to someone who is suspected to have that we're monitoring. That means they have symptoms and they've traveled in a high-risk area, or they've been exposed to someone who has a known diagnosis.
Given that there are these conflicting reports, though, are you guys examining the way that you are talking to these patients and maybe putting things in writing? They say that there was no written information until that were...
We've used the same processes for years. We are meeting with the State Department of Health officials to review all of our processes and procedures. We'll be doing that tomorrow, and we will review the measures for quarantine. We recognize that we can't find any instance across the country where a formal quarantine in writing as available by law has been used. So far elsewhere in the country, verbal instructions have been followed. As far as we can tell, we did hear of a couple of cases where they weren't followed, but generally this is working across the country. The processes that we use are working, and we're going to continue to use them, but we will also review those policies and procedures, including when we might quarantine with more official language than instructions, which seems to be working.
Dr. Page, if you bring up how...
Hold on just a second. Just a second. Let's go here, and then I'll come back to you. Go ahead.
Thanks, Dr. Page. If you would, can you explain how the hotline is working, if all of the calls are coming here, and if they are, what kind of calls are coming in?
So we have 150 calls today. 15 were from a healthcare facility, 11 from a school.
I'm sorry, it's
375 today. What was the
That's the rest of the week. Was
rest of the week?
150.
So 375 today. I thought that was our total. So we've triggered quite a community response. 375 today, 49 from healthcare facilities, 31 from schools, 3 from local governments, 246 from individuals, and we can provide you these details if you like.
Thank you.
Right.
Let me give a quick follow-up, please, sir. So are most of these general calls for concern, or are these bona fide calls that, hey,
These are primarily about information. We are currently monitoring one patient in the county, one individual for travel-related exposure. We have monitored up to 16 for potential exposure in the county, and we're currently only monitoring one. That means the others have been cleared. Wait a minute, Jeremy, then back to you.
Was the younger daughter of this family, was she instructed to not go to school, or were they instructed not to send her to school?
All of the family, as part of this communication, were given instructions to stay at home. We are certainly disappointed that those weren't understood or received. However that communication breakdown was managed, we gave them the same instructions that we give everyone else, and we have been giving everyone else for a long time.
And the other people who were, the Burroughs students who were at the house later on, are there other people that are under voluntary quarantine, such as them?
I'll let Spring explain the extension of that risk to others. Do you want to try and take that?
The CDC does not currently recommend...
Come up to the microphone.
Sorry. The CDC does not currently recommend any additional necessary exposure for someone who has been exposed to a non-symptomatic contact. So those are like contacts of a contact. So neither the father nor the younger daughter are symptomatic in any way, and so anyone else's exposure to them, particularly for brief periods of time, is not really of significant concern to the CDC.
Are they being tested?
They are not symptomatic. The testing currently is not able to rule out COVID unless you are symptomatic.
I think
every indication is that the person could be carrying this and be asymptomatic. So how do you square that?
So I think you have to recognize that testing doesn't work for folks that aren't symptomatic. That's an important message. And so you can't test the family members unless they develop symptoms. We do understand that you can be contagious a couple of days before you become symptomatic, and we recognize that, and that's why we ask folks to self-quarantine whenever they've been exposed to someone who we believe is high risk to develop the COVID-19 disease.
But they can transmit it to another person, say someone who was immunized.
It is possible. It is possible. It is not common. It is a low-risk pathway. But the person who has been exposed to someone else is moderately at risk to develop the disease, and that's why we ask them to self-quarantine.
Dr. Page, Randall Williams said last week that more tests are going to be made available. Is that going to change the county response at all once more people are able to be tested? And are more people able to be tested now, or just the people who meet that very narrow definition of at-risk persons?
We're testing everyone who has developed symptoms and who have a reason to fit the CDC criteria for being tested. We expect more tests to be available. We understand there's more tests that are now available in Missouri, another 800, is that right?
That's my understanding.
Yep. And we expect more to be coming in every day. But we are, when this test is commonly available in the community, certainly it will be more accessible. It's not there yet. But right now we're following the guidelines for testing.
Dr. Williams told us this afternoon there's 880 tests right now. They're expecting 4 million nationwide by the end of Friday.
Mm-hmm.
How much does that mean for Missouri and St. Louis?
Well, I would ask Dr. Williams that. I imagine they'll be sent proportionally based on the expected need. There are places in the country that will need a lot of them. We're not there yet, but we will be prepared.
Is there any concern about the family? Did they go to church on Sunday? Should the public be concerned about that?
There are a lot of rumors in the community, and I would discourage reporting those rumors until they've been confirmed. I don't think it's fair. There was a bit of a panic surrounding this, and I think we all just need to step back and put it all in perspective. It's really not healthy, but we have no indication that from anyone in the community to this date that after this family received notice of a positive test result that they did not comply with our quarantine request.
Are you aware of this family being threatened at the policeman station at their house?
Certainly there's been some disparaging remarks made in social media. We are aware of that, and I think everybody just needs to step back. There was certainly a lapse in judgment here, but it's done. We're reacting to it. We're chasing down the contacts in a very professional way. We have the support of the State Health Department to do that, and we need to move forward and learn from it.
Do you know if police are at their house for their protection?
I believe that police have been patrolling their house, and I think that's fine.
Mayor has closed their Creve Coeur campus temporarily. Can you talk about that situation?
We're still understanding that. That happened very recently, and Bayer has issued a press statement on that, and I would refer you to that. And I believe our health department's been in contact with the person who we're watching, and we'll continue to do that.
This is the travel related.
Yes, it's travel related.
The Post reported this afternoon, they talked with the person who owns a coffee shop, where they were cleaning the shop because the father had supposedly gone in there.
Right.
So how does that work that they didn't violate the quarantine after they were told they're showing up as early as yesterday?
The quarantine was requested on Thursday, but we believe that since the patient was given the positive test results on late Saturday afternoon, that the family has complied with our quarantine request. We don't have any reason at this point to not believe that.
So he did not go to the coffee shop?
I believe that was Saturday morning, but again, we're understanding those details as best we can. But the coffee shop has been cleaned. They've followed all the proper procedures, and I'm sure it's safe.
When was the dance?
Saturday night.
For clarity reasons, doctor, did the mother go out and break this quarantine as well?
We don't believe that she did. We've been in communication with her, and she's told us that she has not. We have no reports from the community that she has. I think moving forward, this family clearly understands where they are today, and our reports from the community is that they're following the quarantine, and I think we should respect that. We should understand that, and we should move forward with recognizing how we're going to manage the coronavirus impact on our community.
Bottom line is the county or in the health department, they're monitoring just one person now?
One person is currently being monitored, and one person is being, besides the Right.
So we have one other person that we have sent for testing. We are monitoring 3 people total for other potential exposures in the community, and we are monitoring 3 people for exposure to the particular person that we have as an identified COVID patient. So.
Spring, let me ask you, man, so the one person that you're monitoring, Bayer has come out wholeheartedly, says we have an employee notified on Sunday. Is that one person specifically that Bayer employee?
That is one of the people that we are currently in contact with, yes.
What do you say to these other companies around? I mean, my social media is blowing up. My coworkers are looking at social media. Your team here is monitoring social media. We're at that point where everyone wants to know everything so fast, too fast. What can you tell them right now with all the rumors of social media?
So I would focus on the CDC's guidelines for travel recommendations, and I would definitely look at your own risk for employees that you think, for any events that you have or any sort of large-scale travel or anything along those lines. There are a lot of different things happening, and I think the appetite for immediacy may sometimes not necessarily access all of the facts that are available. But I do understand how businesses may need to make some of their own calculus about these things, and that is happening as well. And there are businesses that have made choices, and there are certainly information specific from the CDC about travel restrictions to specific countries. I definitely recommend that people review those.
And how are you guys doing in the call center? I know you don't have.
I would definitely like to answer this.
Yeah, I think
So-
that's something we want to respond to.
Are you overwhelmed with calls? Are you getting the correct information out in a timely fashion? Or are you like, oh no, we'll get back to you? Can you
So
explain?
we are doing our best. The call center operates in a tiered fashion. So we are putting that out there because it was our goal to make sure that we did get like a human on the line so that someone had someone to talk to. However, that volume overwhelmed the Department of Public Health's telecommunication system today, as well as our voicemail system. So we are working really hard on a plan. I want to thank many of our other partners, especially the EOC, other law enforcement agencies, and EMS, and others that have stepped forward, expanding the capacity of the call center. So I expect more transitional information about that tomorrow. But please, in the meantime, be patient with DPH. We really want people to focus on calling DPH if you are ill. That is our best opportunity to talk to you about what your risk factors are and whether or not you may qualify for additional screening, and then get you into that screening process. Please focus on the DPH number if you are ill. We are definitely trying to make additional resources available for the call center as fast as possible.
Can you break down the nature of any, 375 calls today? Were they mostly questions, or were they people
Yes.
suspecting they were ill?
They were majority questions.
Just kind of like,
Yes. I have concerns. I would like some additional information. I would like information from my business or from my school. And I definitely understand what should we be doing about emergency planning or kind of moving forward through that. We definitely want to help people provide that information too. That's why we're trying to expand the call centers. We do want our residents to have access to a place to answer questions. There were very few that I don't have a specific count of anybody who believed that they were ill. Or anything along those lines. General information and technical assistance were 300 of those calls.
okay.
So,
Spring, do you have a sense that this could be more widespread than we think? Because you're only testing a handful of people, right? And so if you're only testing people who meet these very specific guidelines, how do you get a sense of how this is affecting the region?
so the guidelines have been broadening like every couple of days from the CDC. We have broadened our criteria along with those to make sure that we are capturing more. As testing becomes more available, and we will see. We don't know. But testing, as it becomes more available and as we move through these processes, will be how we continue to determine whether or not we have ill people and how we help support them as they go through a very painful process.
Secretary, since this happened this weekend, there seems to be a lot of fear that's been fueled. Why isn't more information coming out about the number of people, an exact number of people, that they were in contact with on Saturday night? What's the Ritz-Carlton group? How many businesses were affected?
We're still collecting that information. This is really about a day old. So we're in the process of the Public Health Department, along with their support from the state, has a very organized and formal process where they track down people who may have been in contact with someone who is a moderate risk to have the disease. So that process is ongoing, and as we collect that information, we'll be able to share it. In the meantime, I think the involved institutions are using their judgment and reacting appropriately and in contact with us. And there are other resources.
Do you have any concerns about direct exposure to anyone in the public to the young woman who has tested positive?
No, we have no reason to believe that's been an issue. Everything that we've seen, heard, and been able to confirm is that she was extraordinarily compliant with the instructions that she was given and behaved in a very responsible manner.
She hasn't left the home.
That's right.
Did the younger sister go to school on Thursday and Friday?
I don't know that.
Can you all talk a little bit more about tracking? I know this is going to be hard because we tried to find out Saturday, but some of the things that the viewers are asking us, how do you figure out where she was? Like, talk about the tracking process. You have to get the people on the plane with you. You have to get the people in the Uber, get the people in the train. So, you know, how do you go about the process of tracking everybody that she's?
Well, based on the onset of her symptoms, the CDC has determined that the plane was not at risk. Amtrak is in process of tracking down and contacting everyone who worked on the train or rode on the train with her. They've identified that process, and our public health department is tracking her contacts since she arrived in the station.
Dr. Page, what about jails and nursing homes? A lot of people have been saying they're a priority, but can you
Mhm.
send more information about what you're doing to keep people who, a lot of people living together, how are you keeping them safe?
Well, what we've seen around the community, and we've seen the media reports, which is appropriate, the nursing homes recognizing that their patients are at higher risk to struggle with COVID-19 if they were to get this virus, that they're limiting visitors. Some of them have different policies based on limiting visitors. They may be standardized, but they're also screening. Some of them are allowing visitors in or screening those visitors for travel or other associated risks.
Can you see more information about what the county government or state government could do if it came down to we need to get people quarantined? Like, do you have the capacity to tell people don't leave and punish them if they don't?
We're reviewing our quarantine policies, but at this point, I think it's very important that we are measured in our response. That folks that are at risk, a higher risk to have difficulty with this, over 60, chronic medical illnesses, that they should really think about going out in a crowded space at this point or going on a cruise. Folks that have been exposed to someone who is at risk, who's symptomatic, who's traveled, they should also self-quarantine. Anyone that's been exposed to someone that is suspected or has a diagnosis, they should self-quarantine. So I think appropriate hand hygiene, prevention works. This is a new virus, but the ways to treat it are tried and true. That we need to follow all those prevention steps that work well for the flu. And just be smart and be very vigilant in our activities and our choices that we make in the community. And as much as we can, if you're not at risk, if you're using good hand hygiene, if you're not exposed to someone, if you don't need to be quarantined, then we would ask that you go about your daily lives.
Doctor, let me ask you something far-fetched, if you can broaden this out. You've been focused on your residents in the county. Obviously, this message has gone across the nation with our person accused of breaking the quarantine.
Mhm.
We have conventions happening in this town. We have conventions happening in the region. Pokemon has postponed a convention. Some other conventions are happening this weekend in a couple of weeks. What do you say to that community coming in from far out places? Oh my gosh, the county has this. What do you say to the people?
I think currently in St. Louis County, we have a couple of one diagnosed, one that we're watching, of travel-related exposure. We don't have any community-related exposure. That if you use good hand hygiene and you follow all the precautions, and then you're not especially high risk, then we would ask people to go about their normal day.
Doctor, you've seen this since it started in China. You've seen it really expand and grow up, and then come into the United States. And everything seems to indicate that everywhere it touches, you do start to see more cases coming out of that. As a physician, what are you expecting to see out of this?
Well, I think we can expect that this could look like the rest of the country, but I think at this point we don't know what to expect. We know that we can learn from what's happening, and what happened in China, what happened in the coast. It reached us later, and we have all the opportunities to learn from other people's experience. And we're doing all of that. We're monitoring what's happening here locally. We're monitoring what's happening around the globe. We will communicate clearly with everyone, but I think our response needs to be measured and appropriate.
We just confirmed or had confirmation of 4 people being tested in St. Charles County.
Yes, I heard that too.
Neighboring or even, one county over, just across the state, how does that relate to what you're doing? Are there
We're all doing the
concerns
same
about
thing.
Exposure to people in St. Charles County or St. Louis
Well, so
City or
their public health department.
St. Clair County?
we'll follow the contacts of those folks, and they'll follow all the appropriate procedures for follow-up, for testing, for quarantine. I would expect them to use the same standards that we're using here, that they have a very organized public health department, and all the public health departments in our region are communicating through the Unified Health Command, and we're all working together.
You haven't been notified of any concerns about exposure based on St. Charles, the news there today?
No, I would refer you to the St. Charles County Health Department for questions about the patients that they're watching under their...
I just meant in St. Louis County, you haven't been
No,
informed of
I haven't heard of
concerns.
anything.
Okay.
Doctor, you feel confident of what you're doing in the county and what's going on at the state level? you say? There's been a lot of confusion at the federal level.
Mm.
Varying numbers, yes, there's kits, no, there's not testing kits. Does that concern you, that would inhibit what you're going to try and do here, if you're not going to get the federal assistance you need?
We're getting the federal assistance we need, and regionally, we're making sure that we have the personal protective equipment that our first responders need. We're working on that request. There is some confusion at the federal level. It's largely because of some things that probably were said or tweeted that shouldn't have been, but I think the CDC is a very professional organization. It has a long history of reacting appropriately in times of epidemics and health issues, and I think they're doing a fine job. The Surgeon General, Jerome Adams, is doing a fine job. He's a professional, and he knows what he's doing, and I would listen very closely to what he has to say. I think he's on top of this, too.
Yesterday, they had the Surgeon General, Dr. Fauci, and the task force, President Trump's task force. They all had 3 different numbers on tests and how they would be available.
I can't speak for the President's staff and his task force. I think the CDC is professional, and I think the Surgeon General will choose his words carefully and will give good advice.
Let me ask you, you are the leader here for the county, you have a team, you have a staff, some of you guys are hands-on with it. What are you doing with your routine? We got the Port Authority guy in New York, we got 2 senators. I mean, it's touching anybody and everybody, not in a panicking way, but it can touch anybody and everybody. So what are you guys doing differently as you get up close to this?
Well, we got out in front of this quickly. We had the ability of warning because what's happening on the coast. So we opened up our emergency communications, did a partial opening last week. We started opening up our communication channels. We have a very professional public health staff, a very sophisticated staff. They're in contact with the CDC and the State Department of Health, and I think we're managing this in a pretty organized way.
You said earlier that the county's following an existing procedure for approaching families, talking about their risk and tracking them. When was the last time this came up? How much experience?
Do you want to talk about that?
Doing this?
So there are about 150 different communicable diseases that are reportable conditions in the state of Missouri. And so we predominantly get into this kind of authority when we start to talk about things like tuberculosis. And so that is a relatively common disease. It does require a significant amount of self-quarantine, a lot of individual sort of patient behavior modification, a lot of high touch, high contact with the health department, with our communicable disease nurses. So tuberculosis is probably closest to the model of something in which we have drawn on in this, as the guidance is sometimes not always come out, like in terms of some of this individual pieces. So we have relied on the tuberculosis guidance to also help us.
Okay. In terms of the contacts with this specific family, were they mostly all on Thursday? Was there contact throughout, checking in to see?
There's been contact consistently throughout, yes.
And were they specifically asked, are you all home, are you all quarantined?
So we have modified through this. We have given sort of instructions, but we're definitely learning to what we can do to make sure that those are consistently reinforced every time we talk to them. Mostly the guidance focuses on having us make sure that everyone is well, because that's the primary thing that we've been concerned about. And so we are adding an additional pieces. That's what we're working on with the Department of Health and Senior Services, is adding an additional pieces of documentation for documenting movement.
I mean, again, if you did check in, what did you talk about? You just talked about the patient only,
And everyone else in the house, their state of health is our primary concern.
And it just never came out that they weren't home.
They did not disclose to us. We were clear with the instructions. They did not disclose any additional outside contacts with us.
To that, the family attorney says that the county never actually checked in with the family, that the family was always the one who initiated contact with you guys up until the diagnosis on Saturday. And they're actually also calling these statements a cover-up. How would you respond to that?
So I'm not going to respond specifically to their like comments or sort of the way in which they're characterizing. I am confident in the way that the staff have engaged with the family. Definitely there was a significant amount of contact on both sides.
Did they give you any indication they were going to get an attorney? Why would they get an attorney?
You know, I think there's a lot of panic and inflammation on social media that probably drove a lot of this. I think the theme here is that our county health department staff have used the same process that they've used over and over, not only talking to other patients that have been affected with the coronavirus, but communicable diseases like we always do. It's unfortunate that we're in this situation. It's unfortunate that this posture has been taken, but I think it's time to move forward. And we will hope that we can chase down all the contacts and watch them closely. We hope no one else is infected, but we need to move forward in our community.